covered all of my questions. My biggest concern is that my son's relaxed when we start anesthesia or start any of the IVs.
Absolutely, we can give him something to relax him. Do you think he can take anything by mouth, or?
I don't know. We've had procedures in the past where they give him a little bit of gas in the operating room to relax him, and then they start whatever they have to do. I'm not usually there, so I don't really know what that is.
Well, we have a nice bubblegum flavored mask we can have him breathe to help him relax, and then we'll attempt all our IV placement.
That'll be perfect. He loves bubblegum.
He does? Good. Okay, I think our nurse needs to check a few things with you, and then we'll send Clay back to the operating room and get started.
Thank you. It was nice to meet you.
Hi, I'm going to be Clay's nurse today in the OR. Do you have any questions for me?
No, but I did meet the anesthesiologist, and I just want to make sure my son isn't stressed in any way. He's been through a lot in his short life, and I just want to make sure he goes off to sleep comfortably for the procedure.
Yes, ma'am, absolutely. I do understand what the anesthesia plan is, and that is all of our concern, that he's comfortable and relaxed. We don't want to put him under any more stress than necessary. Your mom, is that right? Are you Clay's mom?
Yes.
Okay. I just need to confirm a few things with you about Clay before we go back to the OR. Is that all right?
Okay. Okay.
So I have to check his bracelet just to make sure that we have the right bracelet on him. Can you tell me his name?
His name is Clay
And his last name?
Matthews.
And what is his date of birth? Can you tell me his date?
April 13th, 1999.
Thank you.
April 13th, 1999.
And what procedure is Clay going to have today?
He's having scoliosis fixed today.
Okay. And who's his surgeon? Is Dr. Pincus his surgeon?
Yes, that's correct.
Thank you. Does he have any allergies to medications?
He doesn't have any allergies that we know of.
Okay. And does he have any loose teeth or contact lenses?
No, nothing like that.
Okay. When we go back to the OR, do you think that he'll be cooperative to be away from you? Will it be okay?
He's usually very cooperative, except with needles. He can't stand being around needles.
Okay. I understand. There are many patients like that. So I think the plan is to give him some gas ahead of time so he will not be aware of any of the IVs placed or any of the lines.
Okay.
I want to check one other thing and see if he had a bracelet for typing screen. Looks like they're still working on that. And has anyone discussed the possibility of Clay receiving blood in the OR?
Yes.
Okay. I see you signed a consent for that as well. And you spoke with the anesthesiologist.
Yes.
Does he have any jewelry or any implants in his body?
No.
Okay. Anything else that you need to know from me today?
No.
All right, thank you. Well, we'll take excellent care of him. If you wait in the waiting room or give us your cell phone number, we'll be able to contact you. That way you wouldn't be tied right to one place waiting for us. And I think we're just about ready to go back. I'm going to check the room, make sure everything is perfect, and then we'll go.
All right, let's get started.
Okay, so everyone is present. Let's go ahead and introduce ourselves. Clay, we're going to be taking care of you today. I'm Dr. Gerard. I'm your surgical attending.
My name is Dr. Sanders. I'm going to be the anesthesia attendant.
I'm Renee. I'm going to be your nurse today.
Clay, we're going to look at your wristband and confirm who you are. I see your name is Clay Matthews.
Clay is not verbal, but that is what the chart schedule and the bracelet said.
Okay. It says your birth date is April 13th, 1999.
That is the correct birthday.
And your medical record number is 12345.
Correct.
What surgery does the consent say Clay is here for today?
It says that Clay is here for a T1 to L1 thoracic scoliosis repair with instrumentation with Dr. Gerard.
Okay, that sounds right to me. And we have the correct electronic medical records, the x-rays?
I assume so. I don't see them.
Okay. Okay, site markings are not indicated. He's having scoliotic surgery. He has no known allergies indicated.
That is correct.
For antibiotics.
Okay, antibiotics for the procedure?
Ansep, just for skin bugs.
2 grams with his weight?
He's pretty big. Yeah, I'd say 2 grams.
Alright, current medications?
Clay is not on any medications that would affect our procedure today. He's not taking anticonvulsants.
Okay. Okay, anticoagulants, SCDs should be sufficient.
Yes.
We didn't draw any blood on him, so we don't have a preoperative crit.
That's correct.
Alright, what about ABO verification?
We need both specimens for this patient. He's uncooperative with needles, so we'll need to send both a type and screen and an ABO as quick as possible.
Okay, we'll take care of that after Clay's asleep.
Great.
Make sure you get both of those samples drawn while you're preparing him.
Okay, I'll take care of that. How many units do you believe we'll need for the procedure?
I don't bleed. 2 units should be sufficient. So, positioning wise, he'll be prone, with a prone view. Beta blockade is not indicated. DVT prophylaxis. We're going to do compression stockings. Antibiotics are covered, and we'll give him nice, warmed IV fluids also.
We'll use an upper and lower bear hugger, right?
I think we're only going to have room for a lower body bear hugger.
Okay.
What do you think?
We could put an upper body just over the upper shoulders and the head, and we could put a lower over the legs, and then we could use room temperature additionally if we need to.
Okay, fine. We'll go with both then. Are all the implants and instruments ready?
Yes.
Post-operative destination. PICU?
Yes. Doctor, do you want the patient?
Okay,
to
so
be
does
ICU?
anyone have any concerns? Are we ready to begin?
I'm concerned that 2 units may not be enough if we get into some trouble. It's a very long procedure. Do you think you could do 4 units of PAC cells?
Okay.
Okay. No other
No
concerns?
concerns on anesthesia's part. Basically, we'll just mask him to sleep and then we'll get good IV access and an arterial line just in case.
Okay.
Alright, let's get started.
Okay. We're gonna send the blood specimens too, correct?
Yes.
All right, let's get started.
Okay, we finally induced. You got your lines in right?
Yes, we've got them in.
Okay, it's been an hour, and we've got another one of these to do later today. Let's get moving. This is still the correct patient, right? His tag still says Clay Matthews, right?
Indeed, this is Clay Matthews.
And his medical record number is still 12345?
That is correct.
And the site marking, I see the x-rays over there. I'm still planning to do a multi-level fusion T1 to T12 scoliosis repair.
We're prepared.
Antibiotics, are we ready to make the incision?
Yes, 2 grams Ansep.
Did we send the blood specimens?
We drew the samples, but it looks like they never got sent to the lab.
What? Are you kidding me? You didn't send the samples down? What were you doing?
Look, I'm sorry, things were hectic while we were getting them ready.
Let's go
Whatever,
ahead and
just
get
send
it
the
sent.
samples down now.
We'll do it, let's get it sent right away.
We're going to have to go ahead and proceed while the labs are being processed. We're already running behind today.
Doctor, this
Any
patient.
objections?
Yes, this patient does not have a history with the blood bank, and it will be a significant amount of time before we know if he has
Look,
antibodies.
Clay is a young man, never had surgery before, never been transfused, and obviously he's never been pregnant. So there's what, maybe a 1% chance he has had antibodies?
Yes, it's a 1% chance, and I think we should find out.
Look, we're at least an hour away from any significant blood loss, maybe even more. The lab should be processed in what, 30 minutes? That's more than enough time. Look, we're at least an hour away from any significant blood.
I understand, doctor. However, if we do find out he has antibodies, we may be about 4 or 5 hours or 24 hours
So what are we
from
supposed
having
to do
blood.
for the next hour? Just keep him under anesthesia, getting brain damage for all I know?
Well, doctor, we need to wait. Whether or not you choose to wake the patient up or keep the patient asleep is up to the two of you, but we should send the specimens and get at least a preliminary result before we continue.
You know what? I'm just going to get started. I don't have time to waste. I've got other patients I have to attend to after this kid. Send the blood now and I'm going to get started. Give me the knife.
We will be happy to send the blood now, but we don't want to make this mistake today. We can write a PSR, we will look at it in the future, it was a mistake, but it's a small mistake compared to a bigger mistake we can make if we proceed.
Fine, you do that.
Okay.